Okay, next we have Dr. Karan Bhatia.
So thank you, John. I am speaking on behalf of Dr. Prashant, who couldn't make it due to an emergency. So this is his talk. Innovations in wet lab training. So cataract surgery is specific. It requires a lot of precision and a lot of hand-eye coordination and a lot of practice in the wet lab. So wet lab training is generally done in animal eyes, eye models, and the future is virtual reality as well. But always the thing is about cost and time is always a big factor in it. So this is the Gotsai integrated model, which was published in the Indian Journal of Ophthalmology, which we were using at Arvind Eye Care System. This is published by Dr. Sunny Sen Gupta, and this is where in the Gotsai, what they've done is a clear corneal incision is made, and then the can you stop interfering in this? Yeah. So the rexis is done, and then the capsule is quite elastic of the goats, and the nucleus is there's no nucleus; it's quite soft. So you can just take debulk the lens of the goat's eye, and then the incision is expanded. And once that is done, a human nucleus that has been taken from the after SICS can be taken and put inside this area. Then this side of the tunnel is or the incision is sutured, and then you can switch over to the other sides and then do your trenching, and you can practice your phaco as well. As a resident also, I have done this. So this is another novel device from Arvind
Vacuum
Pondicherry
assisted
by
whole
Dr.
globe
Seema
holder.
Ramakrishnan.
This is a novel device for stabilizing eyeballs for surgical training. It consists of a cylindrical hollow iron tube closed at one end. This cylinder has an opening in its side wall. The other component is a disposable spring action 6 ml syringe. Being spring action, the piston once pressed returns automatically to its original position. The mouth of the syringe is simply fixed to the opening in the device, and there, the simple cost effective device is ready to use. On our device, we now demonstrate the stability and efficiency of this device while performing various types of ocular surgeries or surgical steps. Small incision cataract surgery or SICS involves fashioning of a sclerocorneal tunnel. The dissecting side-to-side movements can easily dislodge a suboptimally fixed globe, as is the case with conventional globe holders. The device consistently performs well even during nuclear.
So you can see all the steps of SICS are being done and can be practiced using a human rejected eyeball. They had measured the pressures also. This was somewhere between 10 and 60 millimeters of mercury by Perkins after the fixation of the eye. They have also done this, on various procedures to practice various procedures like phaco, SICS. Even they have tried LASIK, even DSEC and DALK, PK, TRAB. So a lot of surgeries and suturing have been done using this simple, cost-effective device. Uh, this is one from the Kitaro one from Japan. So they have been using this also. So this is the factor that becomes difficult in such devices is the cost. So Rexis is being done over here. After Rexis, they are using this device, hydrodissection, and various steps of phacoemulsification are also done in this Kitaro model with the implantation of the IOL as well. Next is the 3D printed models, as John had said, gave a very good talk about it. The future is on 3D printed models as well. So this is a 3D printed scleral ring and cornea and orbit models that are available. So this is soaked in water for 5 minutes, and you can see that corneal suturing is basically possible also in using these devices. So one can practice PK also and various other corneal procedures or a corneal tear using this 3D printed model. This is from the Bionico. So basically, the Bionico model that helps you to better, to practice first in the wet lab, then go to the human eye and make mistakes. So these are the different models from this group that are available. One can look it up. Again, going to the 3D printed, this is what John had already shown, that 3D printing, this is how it takes place, and you can actually devise a lot of devices according to what you need. And since John has covered it, I'll move on. So this is the one that he was talking about, the acrylic mold, and you can practice the phacoemulsification as well. We are definitely using the models that are available from Madhu Instruments, the wax-eye models. I think a lot of people have used it in their wet labs in their hospitals or for training. But this is something you can design yourself and go ahead with it. This is the IC surgical simulator is also available. Then you've got so in this IC you can practice your rexis as well. This is what it looks like. Not so much as real as you would want it, but it does give you a feedback also on how you've done it and what are the different tasks associated with it. There is one more, the India one, that is, there's one in Mumbai as well, the Help Me See simulator. This is being used for SICS and has been doing great. It's got a lot of good positive feedback as well. This is Dr. Prashant's only when he had visited the one in USA. So this this is the surgeon is trying to hold over here and try to make a sclerocorneal tunnel. He did experience a little bit of lag with it, but this is a 2 years old video, so there will definitely be some updates in it. And this simulator is available in a lot of major institutes of our country as well, and got good positive feedbacks are available from it. The next thing in the future is always on virtual reality, and you will see that some things like this are getting developed, and I would just say the future is bright. And you can just they basically tools for this help to demonstrate the steps also in various types of surgeries, and you can plan accordingly as well. So you can even practice your various instruments, how to use the instruments, how to practice your various surgeries along with it as well. So basically, virtual reality is cost efficient. There is maximal skill transfer in the minimum time as well. There are various simulators that are available, but there is the cost of the simulator and the feasibility of it has to be taken into account. However, the wet lab and all of these new innovative models are extremely important because they help to improve the surgeon's confidence and basically reduce the teacher learner stress and increases the resident recruitment as well. But the thing is, they lacked a real the problem is that they've always lacked a real surgical feel as you would get in any in the live eye. So that would never replace it, but it does come close, and it is always better to practice in the wet lab rather than moving on forward to the human itself. This is also video-based skills learning is also extremely important. We used to have this in Arvind, and you can impart your residents and you can discuss these cases. There is one from Cybersight also, a telemedicine-based remote wet lab training program. So I'll just end my talk with saying that tell me and I'll forget, show me I may remember, involve me and I'll understand.